Curious about the potent anesthetic and hallucinogenic drug known as ketamine? Wondering what it's used for, its benefits, potential side effects, recommended dosage, and risks? This comprehensive video dives into the world of ketamine, unraveling its therapeutic applications and shedding light on the risks involved. Ketamine, often referred to as a dissociative anesthetic, has gained attention for its treatment potential in various medical conditions. From managing chronic pain and depression to addressing post-traumatic stress disorder, PTSD, and addiction, ketamine is capturing the interest of healthcare professionals and researchers alike. Despite its promising therapeutic effects, ketamine also comes with potential side effects and risks. It's important to understand the recommended dosage and precautions associated with the drug to ensure safe usage. This video will walk you through all the essentials, providing a comprehensive overview of ketamine's typical uses, benefits, potential side effects, recommended dosage, and associated risks. Join us as we explore the world of ketamine and uncover its potential as a medical treatment while uncovering the necessary information to ensure a safe experience. Medical uses of ketamine. Ketamine has a long history of use as an anesthetic in surgical settings due to its ability to induce a dissociative state, where patients feel detached from their surroundings. This unique property makes ketamine especially useful in situations where typical anesthetics may not be suitable, such as in emergency procedures or in patients with certain medical conditions. Additionally, ketamine's rapid onset of action and short duration of effect make it an ideal choice for minor surgical procedures. In recent years, ketamine has emerged as a potential treatment option for chronic pain. Studies have shown that low-dose ketamine infusions can provide significant pain relief in conditions such as neuropathic pain, fibromyalgia, and complex regional pain syndrome. This analgesic effect is thought to be mediated by ketamine's interaction with certain receptors in the central nervous system, leading to a reduction in pain signals. Furthermore, ketamine has shown promising results in the treatment of depression and other mental health disorders. Traditional antidepressants may take weeks or even months to produce noticeable effects, but ketamine has been found to have rapid antidepressant properties, often providing relief within hours. Research suggests that ketamine acts on glutamate receptors in the brain, leading to increased synaptic plasticity and the formation of new neural connections, which may contribute to its antidepressant effects. Ketamine as an anesthetic. Ketamine's primary use in medical settings is as an anesthetic. It is commonly used in surgical procedures, especially in children or individuals with certain medical conditions that make other anesthetics less suitable. Ketamine works by blocking the transmission of pain signals in the brain, inducing a dissociative state that allows for painless surgery. One of the key advantages of using ketamine as an anesthetic is its ability to maintain cardiovascular stability. Unlike some other anesthetics, ketamine does not significantly depress the cardiovascular system, making it a safer option for patients with compromised heart function. Additionally, ketamine has a rapid onset of action, allowing for quick induction and emergence from anesthesia, which can be particularly beneficial in emergency situations. However, it's important to note that ketamine anesthesia may be associated with certain side effects, including hallucinations, confusion, and vivid dreams during the recovery period. These effects are usually short-lived and resolve on their own as the drug is metabolized and eliminated from the body. Ketamine for pain management. In recent years, ketamine has gained attention as a potential treatment for chronic pain. Chronic pain, which can significantly impact an individual's quality of life, is often difficult to manage with traditional analgesics. Ketamine, with its unique mechanism of action, offers an alternative approach to pain management. Low-dose ketamine infusions have been found to be effective in various chronic pain conditions, including neuropathic pain, fibromyalgia, and complex regional pain syndrome. The exact mechanism by which ketamine provides pain relief is not fully understood, but it is believed to involve the modulation of N-methyl-D-aspartate, NMDA, receptors in the central nervous system. Studies have shown that ketamine can reduce pain intensity and improve pain-related functional outcomes in patients with chronic pain. The analgesic effects of ketamine may persist even after the drug has been eliminated from the body, suggesting potential long-term benefits. However, it's important to note that ketamine is typically used as part of a comprehensive pain management plan and should be administered under the supervision of a healthcare professional experienced in its use. Ketamine for depression and mental health. Depression is a complex mental health condition that affects millions of people worldwide. While traditional antidepressant medications have been the mainstay of treatment, they are not effective for everyone, and their onset of action can be slow. Ketamine, on the other hand, has shown promising results as a rapid-acting antidepressant, providing relief for individuals who have not responded to conventional treatments. Research has demonstrated that ketamine can alleviate symptoms of depression within hours, with effects lasting for several days to weeks. This rapid antidepressant effect is thought to be related to ketamine's ability to increase synaptic plasticity and promote the formation of new neural connections in the brain. By targeting glutamate receptors, ketamine may help reset neural networks that have been disrupted in depression. In addition to depression, ketamine has also shown potential in the treatment of other mental health disorders, such as bipolar disorder, post-traumatic stress disorder, PTSD, and anxiety disorders. The use of ketamine in these conditions is still being explored, and more research is needed to establish its long-term efficacy and safety. Ketamine for treating PTSD and anxiety disorders. Post-traumatic stress disorder, PTSD, and anxiety disorders can have a debilitating impact on individuals, affecting their daily functioning and overall well-being. Traditional treatments for these conditions often involve a combination of therapy and medication, but not all individuals respond adequately to these approaches. Ketamine therapy has emerged as a potential alternative for individuals with treatment-resistant PTSD and anxiety disorders. Ketamine's ability to rapidly relieve symptoms of anxiety and distress has been observed in clinical trials. Studies have shown that ketamine can help reduce the intensity and frequency of intrusive thoughts and nightmares commonly experienced by individuals with PTSD. It may also improve overall mood and decrease hyperarousal symptoms associated with the condition. For anxiety disorders, ketamine has shown promising results in reducing symptoms of generalized anxiety disorder, social anxiety disorder, and panic disorder. The exact mechanisms by which ketamine exerts its anxiolytic effects are not fully understood, but it is believed to involve the modulation of glutamate receptors in the brain. It's important to note that ketamine therapy for PTSD and anxiety disorders is still considered experimental, and more research is needed to establish its long-term efficacy and safety. The use of ketamine should always be done under the supervision of a healthcare professional experienced in its administration. Potential side effects of ketamine. While ketamine offers therapeutic potential, it's essential to be aware of its potential side effects. Common side effects of ketamine include nausea, vomiting, dizziness, and changes in blood pressure and heart rate. These side effects are usually transient and resolve as the drug is metabolized and eliminated from the body. In higher doses or when used recreationally, ketamine can induce hallucinations, confusion, and disorientation. These effects can be intense and may lead to a loss of control or an altered perception of reality. Ketamine's hallucinogenic properties have made it a popular drug of abuse, and its recreational use can have serious consequences on physical and mental health. Long-term use of ketamine or high-dose administration has been associated with a condition known as ketamine bladder syndrome. This syndrome is characterized by urinary tract symptoms, such as frequent urination, pain during urination, and even bladder damage. Chronic use of ketamine can also lead to cognitive impairments and memory problems. It's important to use ketamine only under medical supervision and in accordance with recommended dosage guidelines to minimize the risk of side effects. Individuals with certain medical conditions, such as cardiovascular disease or a history of substance abuse, may be at higher risk for adverse effects and should exercise caution when considering ketamine use. Recommended dosage of ketamine. The appropriate dosage of ketamine varies depending on the intended use and individual factors, such as weight and medical history. When used as an anesthetic, ketamine is typically administered intravenously at a dosage of 1–2 mg per kilogram. For pain management and mental health conditions, lower doses are often used, ranging from 0.51 mg per kilogram. Ketamine infusions for chronic pain or depression are usually administered over several hours or days, under close medical supervision. This allows for careful monitoring of the patient's response and adjustment of the dosage as needed. It's important to follow the guidance of a healthcare professional experienced in ketamine therapy to ensure safe and effective treatment. It's worth noting that ketamine is a controlled substance due to its potential for abuse and misuse. Its use should always be guided by a healthcare professional, and self-administration or recreational use is strongly discouraged. Risks and precautions associated with ketamine use. While ketamine has shown promise as a therapeutic agent, it's not without risks. Individuals with certain medical conditions, such as uncontrolled high blood pressure, ischemic heart disease, or a history of substance abuse, may be at higher risk for adverse effects and should exercise caution when considering ketamine therapy. Ketamine can interact with other medications, such as sedatives, opioids, or benzodiazepines, leading to enhanced effects or increased sedation. It's important to inform your healthcare provider about all the medications you are currently taking to ensure safe and appropriate use of ketamine. Pregnant or breastfeeding individuals should avoid ketamine use, as its effects on fetal development and breastfeeding infants are not well understood. Additionally, individuals with a history of psychosis or certain psychiatric disorders may be at increased risk for adverse psychological effects of ketamine and should discuss their medical history with a healthcare professional before considering its use. Conclusion: understanding the benefits and risks of ketamine. Ketamine, with its unique properties as a dissociative anesthetic and rapid-acting antidepressant, holds promise as a treatment option for various medical conditions. From chronic pain and depression to PTSD and anxiety disorders, ketamine's therapeutic potential is being explored by healthcare professionals and researchers worldwide. However, it's important to approach ketamine use with caution and under the guidance of a healthcare professional. Understanding the potential side effects, recommended dosage, and associated risks is crucial for safe and effective treatment. Ketamine should never be used recreationally or without medical supervision, as its misuse can have serious consequences on physical and mental health. As research continues to uncover the full potential of ketamine as a medical treatment, it's important to weigh the benefits against the risks and make informed decisions in collaboration with a healthcare professional. With proper understanding and responsible use, ketamine may offer new hope for individuals struggling with chronic pain, depression, and other challenging medical conditions.